Good morning and welcome. My name is Dr. Karthik and I'll be running you through the scope of physiotherapy in the world. And along with that, we will also be discussing about how to work upon the Canadian context of physiotherapy. So we are going to begin with talking about the global physiotherapy and the scope of physiotherapy in Canada. My name is Dr. Karthik Shah. I am the founder and director of Into Canada Educational Services. First of all, let's begin with wishing you all a very happy World Physiotherapy Day. I wish and hope that we heal the world together. And this wish comes from me and my entire team at Into Canada. When we say physiotherapy, physiotherapy by definition is a treatment of disease, injury, or deformity by physical methods such as massage, heat therapy, or exercise therapy, rather than having drugs or surgery. By definition, physiotherapy has to be non-invasive and non-abrasive, which means after you have done physiotherapy, a true blue physiotherapy that we talk about, there should be no cuts, no wounds, no scars, no bruises, not even a red patch or a blue patch on the body. Unfortunately, we see a lot of cupping therapy techniques these days which leave solid black or blue marks upon the body. It does not come within the realm of physiotherapy. Similarly, we see wet cupping that is happening these days in the name of physiotherapy. It does not work as physiotherapy by default. By definition, physiotherapy has to be non-invasive. No cuts, no wounds, no discomfort to the patient or to the client. Now, when we talk about physiotherapy, who's defining what is physiotherapy? So when we talk about physio, 400 BC, we have evidence that Hippocrates and Galen were practicing physiotherapy. We also take the Hippocratic oath during our internship or after when we are graduating so that we can serve the humanity better. Officially, it was documented in 1813 by Per Henrik Ling, which was in Sweden. And in 1894, the Chartered Society of British Nurses came into existence. At that time, nursing and physiotherapy went hand in hand simultaneously, and nurses were the ones who took care of most of the exercise regimes or pain relief regimes for them when they were not using medications. In 1918, during the World War I, it was institutionalized. So physiotherapy became an institute, and there were people who actually were trained for doing these therapies and treatments. In 1921, which is almost 100 years before from now, APTA comes into existence, which is the American Physical Therapy Association. And from then on, things have become much more streamlined, much more straightforward. And I would say in the last 100 years, the advances that we have seen, right from using bulky methods of machines like shortwave diathermy machines, ultrasound machines, which used to be as big as TV boxes, to now a handheld device or a remote facility, which I've seen recently a TENS machine, which you can operate while you're sitting in your office and the patient is in another room. And you just press buttons and it can work on that. So we have had a huge jump of entire technology, development, knowledge, skills, which has come into play. However, physiotherapy is a very, very interesting area that we can be practicing upon. When we say global physiotherapy, this map shows us the concentration of physios per 10,000 people. If you see Sweden and Europe areas, that is where the maximum population of physios is, which is more than 20 physios per 10,000 people. If you see Canada and USA, we have less than 5 to 10 people or physios for 10,000 people. Unfortunately, India, which is having 67,000 physios as of right now registered with IAP, we have less than 1%, one physiotherapist for every 10,000 physios. So the scope of physiotherapy, if you look at this entire map, is tremendous and huge. I would wish and hope that everybody who comes to you, who are listening to me for career counseling, should be told that physiotherapy is an amazing profession that you can come with. What we do is, I stay in Canada, I stay in Vancouver, Canada. And as of right now, Canada needs more than 500 physios in the next 2 years itself. And we at Into Canada are a one-stop portal from paperwork to placement. We will work with you upon your IELTS training, your theory examinations, your paperwork, We also provide you with unlimited textbooks, notes, study materials, and examinations. We now have an app which is called as Into Canada. It is available on Android and on iOS. And you will be able to download a lot of details or a lot of data from there, which will be helpful for you to understand how the whole process goes on. We will also be working with you on the settlement services, and we are giving right now guaranteed job placements and immigrations. When we say physiotherapy in Canada, what is required from you is very, very simple. You need to prove that you are safe and ethical. You will be practicing in Canada by 1 degree verification, which is credential evaluations. We will help you with all of these procedures. And there is one exam, which is the national exam of CAPR, and we will help you to train for that as well. Once you have given this thing, you are eligible to work in a private clinic, hospital, care home, or you can open up your own clinic and get your quality of life enhanced. What further you can do is you can do short courses in specializations like masters, or not masters, but very short courses with pelvic floor rehabilitation or with vestibular rehabilitation or with hand therapy. And that adds on to your skill, plus it adds on to your specialization, which means you can earn more than double of what you were normally going to earn in a physiotherapy setting in Canada. And the bare minimum that you can start off in Canada is $7,000 per month, which is roughly about 4 lakhs per month in India. When we talk about that, why do we have such a huge amount of scope is because from paperwork to patient records, everything is streamlined. Day-to-day practice is very, very simple and very, very easy. There is no bargaining. The money is paid either by the insurance or the government. So you don't have to bargain with the patient on every single aspect. You don't have to work upon understanding their needs because there is a very systematic set protocol that comes in. And along with that, you have a lot of other time at hand. Your work is probably going to be about 8 hours. So after that, you can celebrate festivals, take monthly cruises, take trips or vacations, and your work-life balance is amazingly well balanced and well maintained. As a physio, you are going to be assessing, designing treatment programs, monitoring and document patient progress, communicate with physicians, or provide consultation and education services to the community or educational organizations. This is something that you are already doing while you are practicing anywhere else in the world as well. So there's nothing new that you're going to do over there. But the good part of it is you can work in hospitals, private clinics, home care, child development centers, extended care facilities. You can also be working over health planning agencies. So you are the ones who are going to make policies. We are the ones who are going to make amendments in the constitution and try to bring about a change. And you can also work with a part of a healthcare team. Now, when we talk about industry overview, all over the world, there is a huge requirement of physios. In Canada, especially, what is happening is the number of graduates that are developed in Canada are very less compared to the need that we have. And because of that, the government of Canada has now started off newer programs which are going to make you guys eligible to be coming to Canada within 6 to 8 months of your enrollment. And that means in Vancouver, Edmonton, Calgary, Ottawa, Toronto, Victoria, Winnipeg, all of those areas have a very huge demand for physios. And because you are going to be trained with Into Canada, if you do plan to enroll any given time, you already have the whole background of what is required for you. How do you practice over there? What are the ethical skills, so on and so forth. I'll run you guys through that also in the coming slides. But what is required is whatever continuing learning you will need, you will be able to get that thing and you will be able to develop your career professionally throughout your life. When we talk about Into Canada, we will work with you on every small detail from the paperwork. So form number A, line number 2, section number B, this is what you have to fill up. So there is no questions of any delays, any fines, any prolonged discussions that will happen with you and CAPR. We will also work with you upon job placements and settlement services. It can be as trivial as what SIM card do I buy? Where can I get Indian food? Where can I get Punjabi food? Where can I get Gujarati food? Or it could be as big as what bank account do I have? What type of chartered accountant should I be having? How do I plan my life skills further? Because when you get incorporated with into Canada, we are going to be becoming a part of an extended family. So it is not that we are going to work with you only ke okay baba tumhara 10 lectures ho gaya, hamara kaam ho gaya. It's not that. We will work with you through your entire journey as a physio in Canada. Now, people come and ask me a lot of questions, which is, we want to go to USA, we want to go to UK, we want to go to Canada. What works best for us? So my simple two basic points that I would like to talk about on this is, one, USA or UK, no matter how long you are going to stay there, you will never become a part of that country. That is, you are not going to become a citizen. So you will not have a US passport or a British passport 15, 20 years down the line. You may, but not right away. Second thing is, the entire education system and the working system is very, very different comparatively with Canada. In Canada, it's a very simple equation. That means you go get express entry, which unfortunately right now is a big scam that is going on in India. So express entry, what people think is that we will just make that express entry profile, put it in the pool, and we will get selected. Unfortunately, it is like our CET examinations or our cutoff examinations that happen in India. Unless you have a specific score, your chance of getting picked up is technically zero. So right now the score is 525 and above. So 525 points, and normally physios, fresh physios or master's physios, they will have a range of 350 to 450 points. So getting a chance of getting express entry approved and PR done is technically impossible. So please do not fall for that. The second option that most of the people want to select is the student permit. Now, student permit also, I am very, very specific. If you are going to wanting to spend $50,000 and go and study over there, doing nothing related with physiotherapy, people have a misconception that master's or PG diploma in rehabilitation or PG diploma in kinesiology is the same thing like physio. No, it is not. Even after you finish all of those things, you still have to go through this entire credential evaluation and examination process if you want to work as a physio. So you are going to be in Canada, but you are going to be either selling sandwiches in Subways or selling coffees in Starbucks. As of right now, the PTA jobs have also been very, very limited. So don't think of that way. And plus one more important aspect, as a study permit, you will not be able to work in the health sector even for those 20 hours that you get. So make sure you are knowing all of these things and then taking an informed choice. Canada's number one advantage is you stay in Canada after your permanent residency for 1,000 days and you get your Canadian passport. It's a regulated profession, so you are going to get minimum $7,000. I have seen people who have earned $16,000 and $20,000 per month as well. And when we do your initial discussions or consultations over the phone or over Zoom or in-person meetings, you will know that how can you reach those figures very, very easy. The quality of life is amazing. The picture that you see on the screen right now is a picture that I took from my phone. And this is Maleen Lake in Alberta. The best part of this entire thing right now is because of COVID, the only silver lining that came into the physiotherapy part is 70% of your process, including your exams and your job placements, happens in your home country itself. You do not have to leave your current job. You do not have to leave where you stay right now. Everything happens here. When you go to Canada, you start working on day one. Now, how does global physiotherapy work? So in Canada or wherever you want to practice, assessments are done by protocol. There are set standard of evaluations. There is peer reviews, readings, seminars, and workshops happening. The emphasis is more upon the non-abrasive therapy. And patient privacy confidentiality is very, very high priority, and it is implemented to the T. Now comes a very important aspect that we want to discuss here, which is clinical judgment and assessment. Now, when we do history taking, we normally take about 30-40 minutes in the initial discussion to find out what the problem is. This makes us delayed in our assessments, in our treatments as well. And earlier physios, like people like me, we were used to be using crutches. Now, those crutches are not the aluminum ones that we use to give patients. But these are crutches like X-rays, CT scans, MRIs, diagnostic tools, funky gadgets, which will be used to find out what the problem is instead of finding it out through the patient. So globally, what happened is across the world, when I go and take lectures, we found out that there's a protocol that they follow, which is inspection, palpation, percussion, auscultation, and special tests. And this is preceded by a very brief history with which almost all types of diagnosis can be done. So unless there is an underlying pathology which cannot be detected, there is a very high chance that we can assess and intervene in the utmost precision way and help heal the problem right away. Now, how do we do that thing? So one is either the patient will come to you and start giving you big, long stories. I was going there and then that happened and this happened. And over there, you lose track of what actually the problem is and then you go on different tracks. Or there will be sometimes we'll come across patients who are going to be very closed. So they'll be like, do you have pain? Yes. How much is it? Too much. And there are one word answers for us. So we have to reach an in-between place, which is going to make sure that our diagnosis is not misled. And plus we have our entire differential diagnosis in place. How do we do that thing? We work upon this mnemonic. This mnemonic is called as Lord Fincan. L is location. We find out where the problem is. We find out when the problem started. We find out how often does it happen. We find out that when it starts, how long does it last. We find out what is the frequency in the day of that problem. We find out the intensity using a verbal analog scale, which means on a scale of 0 to 10, 10 being the max and 0 being 0, where is your pain? And then we have nature of pain. Again, nature of pain will give you a very clear-cut indication. Is it constant? If it is bony, if it is achy, if it is dull, if it is radiating, if it is sharp, if it is shooting, if it is tingling, so on and so forth. And then comes night pain, which is also a very important aspect because with cancer, we can always find out if the intensity is constant, if the night pain is there, if there are any kind of unrelenting, unremitting factors which are there. We always could tend towards cancer also, which is one of the most rampant causes in Western countries, even in India these days. After that, we come across with constant or intermittent pain. And then we see the aggravating factors and relieving factors. Now, these two are our brahmastras. When they say aggravating factors, you keep those things in mind and ask them to avoid those things while they are doing their treatment or their day-to-day activities. And with the relieving factors, you have an added advantage that you can tell them to do those things and they will feel relief as well. So, for example, if a person says, if I'm going to be putting my leg up in my bathtub, my leg pain is too much. So now you know that he is having a problem with the flexion. So then while stair climbing, while going up on a curb, while going up on any kind of buses or trains, you can always tell them to be careful with that. And that will make a huge difference to the patient because they probably are just thinking on one aspect of it, whereas you give them an entire ADL type of a situation. And that will help build up a rapport with the patient. Along with that, we also work with tingling, numbness, radiation, and paresthesia. And along with this information, if you need, after this, you can perform special tests. And then we are going to have a conclusive diagnosis, which can be treatable and can be managed. And if we cannot do that thing, we always have a choice of referring it to a specialist. Now, when we talk about into Canada, we have our lectures ongoing in Canada, in South America, Africa, Europe, Middle East, India, Nepal, Malaysia, and Australia. What we are trying to do here is we are going to try to bridge the gap in between the global physiotherapy practice. For example, in India, when a person comes to me and gets treated, after they go, let's suppose their wife or their husband or their mother comes in and says, okay, so kya hua? What happened to them? And we'll be like, okay, they have so-and-so problem and we are working with them on so-and-so things. And then we'll be working in future with this thing. You should tell her not to do the smoking part of it or not to do the heavy eating part of it, so on and so forth. Now in India, this is a very normal scenario. But if you go to Canada or if you go to USA, if we talk about the problem of a patient to somebody else, other than the patient without their written consent, we are liable to be breaching their privacy and confidentiality agreement. And that means they can sue us for millions of dollars. So now those things are very, very different because of the cultural aspect part of it. However, there is a very thin line in between us keeping those things globally acceptable. And that's where we come into play as into Canada. We want to assist the next generation of physios to get easy access to resources. Earlier, we used to be working with Kistner, Sullivan, and Maggie, which are the Gita Quran Bible of physiotherapy. Now we have so much of material, so much of research happening. On PubMed, there are about 116 articles that come up every day. So from there on, what do we want to imbibe? What do we not want to imbibe are two different aspects of it. And we will try to work upon those resources. We also want to become a one-stop portal, which means from paperwork to placements for all international physios. Now, we have a career counseling advisory team as well that can work with you. And if you want to discuss, even if you are a student right now of physiotherapy, or you are doing your internship, or you are in your MPT, or you have already finished your practice, your examinations, and you are practicing right now, we can work with you on all steps of the careers. So I would definitely want to get in touch with you guys. The number of mine would be displayed at the end of this lecture. At every resource, at every different course that I take up, anywhere in the world, we have a lot of universities and colleges that we talk to. And while we do those things, we provide them evidence-based resource materials at the end of each info session and workshop. We also provide hands-on therapy with non-abrasive techniques, which are implemented with zero discomfort, and only authentic physiotherapy is being done. Assessment, treatment, and implementation is done according to global standards. So this certificate that you get of Into Canada as a workshop, you are going to be eligible to practice anywhere in Canada or in India using that certificate, and it comes barcoded. So that means it is validated through a barcode. There are certain courses that we are already doing. We do it across the world. When I come down to India, as of this time, I have completed courses in Surat, in Ahmedabad, in Mumbai, in Pune, in Kolkata, in Bhubaneswar. I've tried to do that thing in Nasik. I do it with Belgaum, Karnataka. I do it in Gujarat, northern parts, Delhi, so on and so forth. And eventually what happens is that we want to spread this knowledge. This knowledge is not needed. Even if you want to go to Canada, this is very essential. But even if you are practicing in India, this is going to be a huge advantage for you, where we use non-abrasive silicone cupping or jadestone mobilizations, or we have techniques like assessments, for example, isometric assessments or isometric exercises. We have ankylosing spondylosis or fibromyalgia, which are very, very neglected things, but very rampant these days in India. With Into Canada, you guys have a lot of advantage. The first one is it is inclusive. So once you are with us, once you are registered with us, from everything that you require from paperwork to placement, we will do it with you. There are no limits to learning. So no question is silly or stupid. You can ask us as many questions as you want, and we will be happy to respond to you with that. The peer study reviews are there where you are going to be a part of a group, and that group can always interact with each other, and we will also be putting in a lot of information there. And every single person who's registered with us has a personal case manager. We have the power of two, which means 2 modules of learning, online and offline. Now we have the app, which is going to be having a constant upgradation happening through the days. We have an offline case manager, which will be helping you in any queries that you may have. And then there are 2 wonderful countries that we can train you in, Canada and India. As of right now, we have our lectures, which will be happening online henceforth. But there will be soon lectures happening in India again. And as far as Canada is concerned, it is at present the topmost country for immigration, where a physio is invited and offered amazing opportunities to get permanent residence as soon as possible and becomes a citizen within hardly 1,000 days. Our aim is to spread the knowledge of physiotherapy worldwide in the most correct, ethical, and acceptable manner possible. We also invite questions and queries for any career guidance that you may need for Canada or India, and we'll be happy to help. If there are any questions, I know this is a recorded lecture, but if there are any questions, we will be happy to work with you on every single aspect that you want to talk about. And here are our contact details. The 2 numbers that you see in view are our Indian numbers. I am there in India till September 25th. After that, I'll be in Canada, but we are accessible on all of these numbers. So feel free to drop in a call to text us, to WhatsApp us on the same numbers. My details are given down. My email ID is info@intocanada.ca. If you have any questions, you would like to send your resume to get assessed, where do you stand, what do you do, you are free to come up and we'll be happy to discuss it with you. We, along with Into Canada, we also have 3 more different services that we are beginning this year. One is called as Into America, which is for physios who want to go to America. We have the Dentist Canada, which is for dentists who are going to want to come to Canada. And then we have courses, which are the workshops and lectures across the world that we want to use for giving out knowledge and skills to global physiotherapists, going to their cities, countries, universities, and colleges, and trying to help them and train them. So that's probably about it. I thank you so much, guys, for listening to me patiently. And I wish and hope that all of us are going to be having a wonderful healing experience in our lives with doing physiotherapy. So I thank you, Dr. Pradyot, for having me over for this particular lecture. And I wish you guys again a very, very happy World Physiotherapy Day. All the best, and I'll talk to you soon. Thank you.